Namaste. Welcome you all for the yoga session. Pelvic Health. This is the fifth in the series. When we say pelvic health, well, the emphasis is more on pelvis. Nonetheless, it helps almost all other systems of the body. It is like saying some food is rich in calcium. It doesn't mean it has only calcium. Its emphasis on the availability of calcium is more. That's what it means. Similarly, when we say this series on pelvic health, it does not mean that it's only for the pelvis in that limited sense. Just the emphasis is on pelvis. Well, we will begin with the basics. Lying on back. I have 2 blankets and 1 dupatta available. Fold both the legs, heels closer to the hips. Press the feet. Keep your right palm on the abdomen, left palm on the chest. Initiating and maintaining proper breathing is very, very crucial. As we inhale, the bottommost portion of the pelvis, then the middle of the abdomen, then top of the abdomen should expand all around, and then simply relax. The abdominal cavity contracts as we exhale. Be mindful about the duration of inhalation and exhalation. Make the exhalation longer than the inhalation. But don't force yourself. It should happen. If you inhale for 4 seconds, try to exhale for about 6 to 8 seconds. Make the exhalation slower than the inhalation. Make the breathing a little slower. Average, we breathe about 15 times per minute. So now try and bring it to below 10. Chest stable. Now stretch both hands up. This breathing you should be aware, and you should maintain, you should sustain this. With practice it becomes easier. Raise your right leg up. Pull the kneecaps, stretch the heel, toes towards the knee. Feel the stretch at the back of the thigh and the calf muscle. Down. Change. Left. Pull the kneecap. Stretch the heel. Press the right foot and tighten the back of the right thigh also. Down. One more time, right leg up. Down. Left leg. Down. The next one, right leg up, fold, hold the knee from both hands, pull the knee closer to the chest, toes towards the knee, tighten the back of both the thighs, feel the gluteal region and the lower back. Down. Change. Left leg. Fold, hold the knee, press the knee closer to the chest. Feel the pressure of the thigh on the abdomen. Breathe abdominally. Release left leg. One more time, right leg up. Fold, hold the knee, press the knee closer to the chest. Down. Left leg. Fold, hold the knee. Press the knee closer to the chest. Release left leg. The next one, right leg up. Fold across Padmasana, taking the right heel as close to the root of the left thigh as possible. Stretch the toes up, push the knee back. Press the left foot, tighten the back of both the thighs. Feel the knee capsules. Release right leg. Change. Left leg up. Fold it across. Push the knee. Feel your pelvis as we inhale and exhale. Watch your sacral region, the sacrum. That is the portion of the spinal column just below your lower back. Flat, bony area. Down. One more time, right leg up. Fold Padmasana. As we inhale, the pelvis and abdomen should expand. As we exhale, we should feel the contraction therein. Down. Left leg. Fold it across. Down. The next one, right leg up, fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. Feel the gluteal maximus muscle. That's where you are getting the stretch. Release right leg. Change. Left leg up. Fold from right hand. Hold the ankle joint. Pull it. Stretch the toes up. From left hand, push the knee across the chest. Feel the gluteal and the back. Release left leg, then change. Right leg up, hold the ankle joint, pull it, press the knee across the chest. You have to press the left foot and tighten the back of the left thigh. You have to tighten also the back of the right thigh. Be attentive. Down. Change. Left leg. Hold the ankle joint, pull it, press the knee across the chest. In all this, you should try to flatten the sacrum against the mat. So you should remember. The more you tend to flatten the sacrum and then push the knee, the better will be the stretch. Release left leg. Now slowly get up from the right side. Sit upright. Now we are going to do the following. First, sit in the all fours position. This is a very familiar posture, a variant of Ardha Hanumanasana or Ekapada Prasaranasana as we call. Take your right leg forward, both hands on the waistline, look forward. Sit as much as possible. Stretch the left leg, bend your right leg, lower the right hip, breathe well. What you have to note is that the right hip is in flexion while the left hip is in extension, and so feel the pelvis on either side. Slowly come back and then change. Left leg forward. Tighten the right calf and thigh and the hip also. Look forward. Slowly come up. Sit upright. Now fold the blanket. Sit on the blanket. We will do a couple of twists before we look at the other postures. Sit upright. Left hand on right knee, right hand fingertips on the floor. Turn. Turn the neck also in the direction of the twist. As we inhale and exhale, watch your pelvis. Slowly come to the center and then chain. Inhale, exhale, turn. Slowly come up. All these twistings are good for the pelvis, abdomen and neck. Of course, the complete back gets benefited. One more twisting. Fold both legs to the side, taking the feet to your left side. Thighs should be in the forward direction, running parallel. Sit upright. Left hand on right knee, right hand fingertips on the floor. Inhale, exhale, turn. Bharadwaj Asana. Breathe slowly. Even here, try to make the exhalation little longer than inhalation. And especially you should watch the pelvis. Slowly come up. Change side. Sit upright. Right hand on left knee, left hand fingertips on the floor. Inhale, exhale, turn. Feel the right side and left side of your pelvis. Slowly come up. Sit upright. Now we are going to do Janu Shirsasana, not the classical forward bend. We will do the following. Sit on the mat, left leg straight, right leg also straight. Sit upright. So you have to be seated on a little height, but you have to fold the blanket and sit. Then fold your right leg, taking the heel to the root of the left thigh. And then take the right knee as far as back as possible. Stretch your left leg. So this angle should increase. That's what we mean. When you increase that angle, you get that better open for your pelvis. And exhale, turn. Keep the hands and turn. Chest and navel up. Left leg absolutely straight. Now bend, and if possible, hold the foot. You don't have to bend too much forward. You have to stretch the trunk and breathe deep. If you have difficulty in reaching the foot, take a dupatta and you can place the dupatta against the sole of the foot and hold the both edges and stretch the trunk and navel up. And you have to twist the trunk. The center of the chest should be aligned with the left leg. Then breathe abdominally. If you can hold the foot, that is good, but stretch the trunk. Pull the kneecap, left side. Feel the stretch in the left hamstring. Tighten the back of the right thigh. Slowly come up. Stretch right leg also forward. Then chain. Fold left leg. Left heel to the root of the right thigh. Left knee as far back as possible. Right leg straight. Left heel to the root of the right thigh. Keep both the palms on fingertips on the floor. Turn. By turn we mean that you align the chest to the forward direction. Then chest and navel up, lean forward, hold the foot. Chest and navel up. If you cannot hold the foot, you can use dupatta to make up for the gap. Watch your breathing. Slowly come up. Both legs forward. We'll repeat this. Fold right leg. Push the right knee as far back as possible. Keep the fingertips on the floor and turn the chest. Left leg absolutely straight. Lean forward. Stretch the trunk from the base of the pelvis. Left leg absolutely straight. Slowly come up. Right leg forward. Chain. Fold left leg. Take the left knee back. Right leg straight. Align the trunk. Keep the fingertips, align the trunk. Slowly lean forward. Hold the foot. If you cannot hold, then use the putter. The more you stretch the trunk diagonally up, the better will be the effect at the pelvis. Keep on pulling the kneecap. Slowly come up. Both legs straight. Then chain. Twist the trunk. Chest and navel up. Lean forward. Hold the left foot. Breathe well. You can repeat from 2 to 4 times. Slowly come up. So what is important here, we should understand that we are not trying to do a forward bend in that strict sense here. See, you have to turn and then stretch the pelvis up is important. Going down we are not doing because this class is not intended for a forward bend. It's more to slowly come up, activate the pelvis. Right now, hold the legs, sit upright. And now we will do Baddha Konasana. This is one of the very popular postures when we talk about pelvis. Is Baddha Konasana. So sit upright in Baddha Konasana. Chest and navel up. Watch your breathing. Now from left hand, hold the right foot, right hand fingertips on the floor, inhale, exhale, turn. Stretch the trunk up, twist and breathe well. Slowly come up, chain from from right hand, hold the left foot, left hand fingertips on the floor, inhale, exhale, turn. Slowly come up, sit in Swastikasana, sit upright. Now we are going to do Upavishta Kodasana. Ensure not to overstretch, just stretch your legs sideways. Both legs straight, hips on the blanket, stretch both legs and be seated upright. Both legs straight. This is also a very good posture, which gives a good lateral stretch for the pelvis and also very good for the pelvic floor muscles. Now, as you inhale, feel the expansion of the pelvis. As you exhale, feel its contraction. Especially when you inhale, you must feel all the boundaries of the pelvis. The pubis at the front, the sacrum at the back. The wings of the hip bone at the sides. And below you should feel the perineum. Actually, pelvis is tilted. It's like this, forward. Quite a good tilt. That's how it is. Chest and develop. So this is also very good posture. Upashta Konasana, you have to pull the kneecap, stretch the heel, roll the thighs slightly in, but keep the trunk upright. So it's a good practice to sit on a little height by folding the blanket so that you can comfortably keep the trunk upright. Okay. Hold the legs, sit upright. Now we are going to look at firstly this Kapalabhati, because that is very useful for the pelvis. And then we will look at another breathing technique for the pelvis with emphasis on the two chakras that are located in the pelvis. We'll come to that. First, just to energize, we will do Kapalabhati couple of times. Palm should face upwards, tip of the thumb and index finger in contact. Gently close your eyes and watch your breathing. As you inhale, the pelvis and then the abdomen should expand. As you exhale, it should contract. Special emphasis at the pelvis. And remember all the ground rules. Ground rule number 1. Your breathing rate should be somewhat less than 10 per minute. If you can come to about 7 or 8, it is good. Less than that is also good. And with practice, you can go to 2 per minute. But don't hurry through. Don't make it an uncomfortable feeling. Very important. It should be a very, very comforting, soothing feeling. So I would say about 7 to 8 breaths per minute is fair enough, and most can do that. Ground rule number 2, make the exhalation little longer. Maybe couple of counts more than inhalation. Now we are going to do the Kapalabhati. You have to contract the abdominal muscles, expel the breath quickly, forcefully, and then relax the abdomen. Air automatically enters in. I repeat, contract the abdominal muscles with a gentle force, expel the breath quickly, forcefully, then relax the muscles, the air automatically enters in. Don't be too forceful, don't be too speedy. If you have practice, do for 60 times and then stop. Otherwise, even 10-15 times and then stopping is okay. Don't hurry through the process of learning. We will do 60 times, remembering all the precautions. The moment you relax, there is a small period of Kevala Kumbhaka, where there is neither exhalation nor inhalation nor retention of the breath for few seconds. Try to capture that. So we will do 60 times. Be relaxed. Good. Slowly open your eyes. Now sit upright. Now we are going to watch the two lower chakras. So I personally prefer Padmasana because it's a very stable posture, but if you can do Padmasana. If you have difficulty, Swastikasana is okay. Sitting on the chair is also okay. Sit upright. Chest and navel up. Palms facing upwards. Tip of the thumb and index finger in contact. Now watch the base of the spine. To be precise, first feel the region between the two excretory organs. That must be easy. That is called the perineum. Then get to the center of that perineum, and just above that center, inside, that is the location of the root chakra, Mooladhara chakra. These chakras are like mini brains. They profoundly influence the endocrine glands. Now just sensitize that region of Mooladhara chakra. How do you sensitize? Point number 1, move your attention to that region. Point number 2, breathing. Slowly inhale. Imagine as if the whole breath, rather the whole pranic energy is moving into that spot, Mooladhara chakra. And as you exhale, imagine that pranic energy or the breath is starting from there and coming out through the nose. So put it in other words, it's as if your whole body is concentrated at Mooladhara chakra. Your whole body is shrunk into Mooladhara chakra, and it's just that air is going in there, coming out there. And breathing rules maintains slow inhalation, slow exhalation. About 78 cycles per minute, exhalation longer than inhalation. And now feel the Mooladhara chakra, nothing else. Get completely absorbed. And feel the transition between inhalation, exhalation, exhalation, inhalation. It's a beautiful feeling. Inhale. Then before you exhale, there is a transition. In the transition, you can deepen your awareness about the Mooladhara chakra. Similarly, after you exhale, before you inhale, there is a transition. Make use of all that. Now we are going to do the following. The Bijakshara associated with this chakra is Lam. So we are going to pronounce that word Lam as we exhale and feel the vibrations in the region of Mooladhara chakra. So I have to slowly inhale. As we exhale, pronounce the word Lam and feel the vibrations in the region of Mooladhara chakra. You can join with me, slowly inhale. Be relaxed. Feel the inner calmness. Salutation to Sage Patanjali. Take a deep breath. Yogena jittasya padena vajam malam sharirasya cha vaidyakena yopakarottam pravaram muninam patanjalim pranjaliranatosmi hari om. Shri Krishnarpanamastu. Shri Gurubhyo Namaha. Shubhamastu.